So as you know, the anti-diabetes effects of jackfruit have been reported in some studies. Jackfruit is rich in dietary fiber, carbohydrates, vitamins, and minerals. The green or the unripe jackfruit is used as a vegetable. So to understand the efficacy, it's important to do a randomized control trial. And this was a randomized control trial which was published. And in the study, people of either gender, age 18 to 60 years, diagnosed with type 2 diabetes for more than 1 year and stabilized on oral anti-diabetes drugs and having an A1C of less than 8% at screening were eligible for the study. And it was a study in which Group A and Group B was studied. In one group, of course, green jackfruit flour is given. I'll come to the details now. So this was a randomized double-blind design and used was used in 40 participants with type 2 diabetes. Glycosylated hemoglobin, fasting, and postprandial glucose were determined at 0 day and also on the 84th day, which is 12 weeks. As you can see, the intervention was 30 grams of green jackfruit flour per day divided between breakfast and dinner. So in the study, in the step 1, green jackfruit flour or placebo was added using the measuring spoon. And as you can see, it was given as an add-on, as initially the green jackfruit flour was added and then the rest of the flour was added. And then the regular flour or batter and prepared daily food as usual was given. As you can see in this picture, you can see green jackfruit flour given for breakfast and for dinner. And you can see in the group B, placebo flour, which could be rice flour or wheat flour. So this is a placebo here which was used was rice flour or wheat flour. And you can see these were the baseline characteristics of the study groups. In group A, the mean age was 46, and group B, the mean age was 46, so comparable. The rest of the features were also comparable between the two groups, including the duration of diabetes, which was 5.9 years in group A and 5.77 in group B. You will also find the change in all the parameters, the HbA1c, fasting, postprandial, and body weight. It's important to note that you can see that both in the group A as well as group B, in the green jackfruit flour group as well as the placebo flour group, there was an improvement, but the improvement was better in the green jackfruit flour group, and this difference in the change was statistically significant for all the parameters. It is for HbA1c here, for fasting plasma glucose here, for postprandial glucose here. You can also see that the mean body weight did not change, and these are values given in milligrams and millimoles per liter because both are used in different countries. And you can see the body weight, the p-value was not statistically different, so the body weight did not change in this short study. So you can see in group A, in which people were using green jackfruit flour 30 grams per day for 12 weeks, there was a reduction in A1C of minus 2.5%, whereas in placebo, there was a marginal increase and the p-value was 0.006, which suggested that green jackfruit flour could reduce HbA1c in this study. Notably, because the placebo flour contained rice and wheat, in this present study, jackfruit flour, and I'm sure our nutritionists on this panel will be better placed to talk about these intricacies than me and also talk about the isovolemic aspects of the methods used. Jackfruit flour had 25% lower calories, 33% less net carbohydrates, and 57% more fiber in comparison to the placebo group. And this suggested that jackfruit flour as compared to the placebo rice wheat flour may be a promising intervention to improve glycemic control as a replacement to rice or wheat flour. So the limitations of the study were acknowledged in the paper is that this was a small sample size, a short duration study. Placebo difficulties are there in any nutrition study. So for several reasons, to mimic the comparison as much as possible, because in one group you're adding jackfruit flour, in other group adding inactive substance made really no sense, because you want to compare it to the standard of nutrition, which is rice flour or wheat flour, and therefore, but this also posed some placebo difficulties, as in any nutrition study. This was a single center study done in Srikakulam district, and then in a government hospital. Maybe in a largest multi-center study could give more wide, broad results, and the HbA1c was kept below 8%, because if the HbA1c is very high, then the chance for more aggressive therapy and hypoglycemia occurs, and then HbA1c was conservatively kept below 8%, also probably keeping in mind that people had to be reasonably stable in their glucose control, and highly unstable patients with high blood glucose may not be ideal for a nutrition study, because the concomitant adding on of medication may make analysis difficult. So, multi-center, multi-country powered study would be, of course, ideal for a large population for a longer duration, and people with higher HbA1c. All this may be needed to confirm the clinical significance and generalize these outcomes to a wider population. But for the present, the study showed statistically significant differences between jackfruit flour and the placebo flour. So from the study, we can conclude that green jackfruit flour, 30 grams per day, was found to be effective in lowering the levels of HbA1c, fasting plasma glucose, post-meal plasma glucose, compared to placebo flour in people with type 2 diabetes, in which you replace an equal volume of rice or wheat flour in your daily meals. So that concept that it is a replacement which is giving you the medical nutrition therapy benefits is very important. And I've also highlighted what are the medical nutrition therapy differences that replacement of green jackfruit flour would make. One hopes that this small beginning in nutrition research of Indian traditionally available foods will make a meaningful context to changing research, to inspiring others to do similar research, and therefore bringing better diabetes care to people with diabetes. It has been a pleasure talking to you about this topic, and thank you all for listening to me.